Good afternoon, everybody. I am Sanya from your host from today's live from All About Skin Wellbeing team. I am sure all of you must be keeping good health. Today, we are going to discuss about our skin healthy with the focus on urticaria or hives, which our near and dear ones would have encountered at some times in their lives. Urticaria is characterized by brown rash on the skin that itch intensity, and it may be due to chemicals in certain foods, allergies to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffered urticaria at one time. 60% of patients are in the age group of 20 to 40 years, and incidence is higher in older age. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing that we can get to hear from an expert dermatologist online for about urticaria and its type, how can we prevent it, and the kind of test which is required for its diagnosis, the right treatment and management approach for early life. So, ladies and gentlemen, girls and boys, we have with us today renowned dermatologist of India, Dr. Sarmistha Basak. She is a renowned dermatologist and cosmetologist and has an experience of 18 years in this field. She completed MBBS from Calcutta University and in 2005, post-graduation in health sciences and medical autonomy from Anna University, and master's in practical dermatology from Cardiff University. Also, fellowship in cosmetic dermatology from Elamate. Her skill and compassion have tremendous effect in patients' lives. A very warm welcome to Dr. Sarmistha Basak. It's a pleasure to have you with us today.
Thank you. My pleasure to be here.
Thank you so much, Doctor. And Doctor, as we are going to talk about urticaria, and urticaria is very common in general public, and it is quite ignored by the general public. And today we are going to discuss about its management, its types. My first very question is that usually what is urticaria? How can we define urticaria? How can people identify that this is urticaria?
Urticaria is commonly known as hives. These are actually itchy rashes, which may be which is usually more than 0.5 centimeters. That is more than a papule. It's slightly bigger, and they are very itchy, extremely itchy. The rashes are raised from surface, red in color, and it may involve any part of the body. And when it involves your lips, your eyes, your neck, then we call it angioedema. When the urticaria involves the deeper tissues, we call it angioedema. So this is it. Actually, urticaria is itchy skin rashes which are swollen and red.
Okay, so as you said, doctor, that urticaria is basically red in color, itchy, and swollen. And usually people complain about itchiness, redness, but they go to a medical store, take some medicine, and treat by themselves, and they think that it can be treated by these medicine. But sometimes it get worsened. But doctor, how can it be caused? Like, what are the reasons urticaria can be caused due to any particular specific reasons?
Urticaria, they may be spontaneous without any cause. That is the most common type of urticaria, and sometimes there may be a trigger. Most common is the infection. Sometimes food streptococcal infection can lead to urticaria. Some food, some medication like aspirin, painkillers. There are certain antihypertensive and there are so many which lead to urticaria like rashes. Among the food items, most common we find that shellfish, nuts, some vegetables like brinjal, and some food which has some additives or preservatives in it, they may lead to urticaria. Actually, anything and every food item can lead to urticaria to the susceptible person. There are other things as well. These are some people can develop urticaria while out in sun. We call it physical urticaria or solar urticaria. Likewise, some people can't hold a piece of ice, and that is cold urticaria. They get urticarial rashes during winter months. Some people pressure while wearing a tight garment. People complain of itchiness. This is called pressure urticaria. So there are vibratory urticaria. There are so many. So these are all physical urticarias. So there are many reasons, and some people might be suffering from certain diseases like autoimmune diseases like diabetes, thyroid disorders, vitamin D deficiencies, which may be associated with urticaria.
Okay, so doctor, as you said, there are many triggers of urticaria. Sometimes if the person is getting first time urticaria, how can somebody identify that this is something which is, I am allergic to, or this is something I should not eat to
So when a person who comes to us for the first time with an urticarial rash, there are certain questions we ask, that what did you eat, or what did you do in last one day. We ask them to maintain a diary. We always treat them, but we always ask them to maintain a diary. And even if there is a trigger, there is the rash recurs, we can find out with that. So it is this happens with acute urticaria only when the person is coming for the first time. But sometimes person know that, hey, I'm allergic to this and this material, then we ask them to avoid it.
Okay, doctor, many people must have come to you, that this is happening since few days, and I am self-treating it or going to the medical shop, asking, for the medicine, and till then it is okay, and then they are occurring again and again. So, is there any main reason for the urticaria which is coming again and again? And is that happen to you that somebody have come and self-treated the urticaria and it has got worsened?
See, that's why urticaria is commonly classified into two types, like acute and chronic. When an urticarial rashes is coming or recurrent for less than 6 weeks, usually we take a 6 weeks as a cutoff mark. When it is less than 6 weeks duration, then we call it acute urticaria. And if it is more than 6 weeks, if it is persistent for more than 6 weeks, then we call it chronic urticaria. Nobody knows when chronic urticaria is going to go. Acute urticaria is chronic or acute. Both can be life-threatening sometimes, and if not treated properly. So sometimes what happens, you have taken a medicine which has given you an urticarial rash, you didn't take the medicine at all, then that means it was due to that medicine. So we will have to know what to avoid, which to avoid, which thing to avoid, then your doctor will be able to help you. You can buy a medicine from the medicine shop, but you don't know what the doses are, how to treat it. So that's when comes the role of a dermatologist. There is a certain protocol to follow, how to treat a case of urticaria.
Right, doctor. And as the doctor said that you must consult your dermatologist if you are seeing some kind of urticaria, or if you're feeling that the redness and itchiness is not going, because consulting a dermatologist is must, and it is very important to consult a dermatologist. Doctor, as you said, there are two types of urticaria, that is acute and chronic. And we'd love to know that what are chronic urticaria types, and how will they go away, and how they can be treated?
See, chronic urticaria is sometimes difficult to treat. Their first line of treatment is antihistaminic or anti-allergic, which we commonly say. There are various types of antihistaminics. Some are sedative, some are non-sedative, depending on the age, depending on the duration, depending on the age of the patient. We find out what antihistaminic has to be given and in what dosage. First, basic, and there are also other types of antihistaminics. Some are H1 antihistaminic, some block H1 receptor, some block H2 receptor. So sometimes we combine both the type of antihistamine. Those are just treatment protocols we follow. So we prescribe, first thing is we prescribe antihistaminics. Then we try and find out whether there is any trigger or not. Then we ask the patient to avoid those triggers. Sometimes we, as I told, that sometimes vitamin D deficiency, thyroid disorder, some autoimmune diseases are related with it, and we try and treat those conditions. And also sometimes we refer if it is it involves some different specialties. And after that, if we see that it is not going, then comes some certain immunological medicines, some immunomodulator medicines like cyclosporine, long-term corticosteroids, azathioprine, omalizumab, so many things. And when it comes to that, we have to always monitor the patient, and we have to always go for certain tests, check whether their health is okay, whether their blood pressure, weight, everything is okay. Then only we prescribe, and there is also a protocol to follow. We follow those, and then chronic urticaria can be managed.
Okay, so as doctor said, chronic urticaria can be managed, but you have to go to a dermatologist, consult your dermatologist, and if you have any kind of health issues, you should necessarily go to a dermatologist. Doctor, is it like that, that urticaria can be only happen to some certain age groups, or it can be happen at any age group, like the children?
No, it can happen, as you said, that it is more often in this and this so age group, but it can happen to anybody. I have seen under 5 children also. I have seen 80-year-old also patient with urticaria. So it can happen to anybody anytime. And also another trigger I forgot to mention, that alcohol is a big trigger of urticaria. So if you have to take that history also, whether you have taken alcohol the day before, food like aged cheese, wine, they can trigger urticaria.
Okay, so these are more triggers that doctor said alcohol, wine can trigger your urticaria. Doctor, sometimes people don't know actual the reason of urticaria. They go outside the sunlight or travel, and they complain about urticaria, that due to sunlight or I'm traveling, urticaria has happened, and what somebody should do. And is urticaria is a serious disease?
Yes, obviously urticaria is very common, but it can be very serious when it affects your mucosal membranes, means your lips, your neck, your genital area, your eyes. It can be serious then, because it may lead to choking and it may lead to death even. So in that case, you have to be, when you feel itchy, when you have started feeling that your tissues are going to get swollen, that you are feeling itchy and some swelling is coming up, take antihistaminic. Some people who know that they suffer from urticaria, they usually carry a pen called EpiPen, which contains epinephrine, which is an injection which we doctors usually inject before sending the patient to hospital. Solar urticaria or sun-induced urticaria is a very rare thing. Only maybe in my 18 years career, I have probably seen 3 or 4 patients of them. It is not that common, but yes, I have seen them when the patients who go out and they in the sun, and after a particular time their skin becomes red and swollen. That can happen. There are other triggers as well, as we just discussed. Sometimes while you are out, and if you are an allergic person, and then you may be allergic to the certain insect bite also, which you can't see with your own eyes, because you are using somebody else's, you are living in, I mean, I'm talking about travel right now. So when a people travels to to a new place, and they are staying in a hotel or any facility, and they don't know what kind of hygiene they are maintaining, what kind of, whether the bed sheets are clean or not. If a person who is allergic to those things, or some people are allergic to mold, some people are allergic to house dust mites, they may get arterial rashes from that, from those things. So always carry your anti-allergics with you if you are an known allergic person.
Right, doctor. And as doctor said, if you are a urticaria or allergic person, you should always keep a kit of all the anti-allergies. And as doctor referred to you, doctor, sometimes some products also harm your skin, and are they can be the cause of urticaria. Somebody suggested that you should put this particular thing on your face or on your hands if you're having urticaria. Are these products also can cause urticaria?
Yeah, but those products, usually you find it, it is a transient thing, because when it is usually, when a patient or when a person sees that he or she is having rashes with that particular product, they will stop using that, and the reason and the lesion goes. It is always, it happens. I myself have seen a few cases after applying mehendi, the hand gets swollen. So these are called contact urticaria. These can also happen, but you will know that which is the trigger in those cases, and you will immediately stop those things.
Right. And I think people should stop, stop using those products immediately.
Of course, because
Right, doctor?
next time that it is going to be more severe.
Yes, doctor. Doctor, sometimes people ignore also urticaria, that it is a rash; it will go by itself. So we really, want to know that if somebody did not treated the urticaria, what are the potential complications which are related to it if it is not treated well?
See, uh, I disagree with you that people ignore, because people, arterial rashes are so severe, people can't ignore. They have to use certain kind of medication, be it self medication, be it medicine. They may buy the medicine from a pharmacy, take somebody's advice, not a dermatologist obviously, but they will take some advice and they will try to treat, because the rash is so itchy. They can't sleep, they can't sit. So it has to be treated. When patients come to us with urticaria, most of them, they have received some form of treatment. When they can't get out of it completely, they only consult the dermatologist. So as I said, that if you remove the trigger, in case of, if it is an acute case, the barrier is 6 weeks. Arbitrary mark is 6 weeks. If it is less than 6 weeks, then it is an acute case. If it is more than 6 weeks, it is a chronic case. If it is less than 6 weeks, people know, the people have removed the trigger, and they will go on its own. They may or may not come back. But if it is chronic urticaria, people, the lesion will come. They will take certain antihistamines. They may or may not consult a doctor, but the doctor, I mean dermatologist, but they will have to take something. Otherwise, they will not be able to stay sane.
Right. So it is necessary to take some precautions,
Some
medication.
medicine. Yeah.
Right, doctor. Doctor, as you said, that urticaria is itchy, and sometimes it is very worsened. So, does urticaria also make somebody tired?
See, urticaria is itchy. Urticaria is Sometimes urticaria is associated with angioedema, which is actually swelling of the mucosal areas, and their subcutaneous swelling. Sometimes it may in sometimes we have seen that people where there is only subcutaneous swelling, itching is not that much. There is pain. This is another form of urticaria. Sometimes difficult to diagnose, difficult to manage. Tired, yes, because there some vitamin deficiency may be associated with it. Patient may be hypothyroid, and more because that they are so itchy that they scratch all night and they can't rest. That is the most common reason that they feel tired. And sometimes some antihistaminics people take, they may be sedative antihistaminics, which makes you feel very sleepy. And those antihistaminics may make the people groggy all day.
Okay, so urticaria can make you tired because if you are not treating it, or you are not taking proper care of yourself, it can be tiring, as doctor said. The doctor, when we are talking about urticaria can make you tired. Sometimes when people do not treat it, and they keep like scratching it, so other people feel not safe to go around to that person. So it is like contagious, or it is like it cannot be spread from one person to another.
It is not at all contagious. It is urticaria is not at all contagious. Only it may be a coincidence if more patients of the family, if all members of the family get it, but it is not at all contagious.
Okay, so next time if you see somebody, having urticaria, you are safe because, as doctor said, it is not contagious. It cannot spread from one person to another, right, doctor?
Yes, absolutely.
Yes, so it is like that. Doctor, when we were talking about the triggers, you were telling us there are some nuts, there are no alcohol and wine should not be taken by the patient if he or she is suffering from urticaria. Do you like we can discuss about some dietary precautions or do's and don'ts of for a patient who is already having urticaria, and should take care of those dietary, should not eat or drink some particular things.
Sometimes what happens is when a patient comes with acute urticaria, we ask them to maintain a food diary. And also, if the urticaria is severe, we prescribe medicines, but along with that, we ask them to avoid known triggers like shellfish. If he or she is a non-vegetarian person, we ask about shellfish, shrimps, prawn, crabs, all those comes under the shellfish category. We ask them not to take it. We also ask not to take brinjal, tomatoes, nuts. These are the common triggers. Avoid alcohol, certain medications, if possible to avoid. And then most of the time patients can recall that what they had eaten, and then we ask them to avoid those things.
Okay, so there are the do's and don'ts. If you are having, if you are already taking some kind of medications, you should avoid eating, and you should consult your dermatologist if you are having more urticaria or redness and itchiness. Doctor, as we have discussed that the urticaria types, and of course, what are the do's and don'ts of urticaria. Sometimes people also complain about stress urticaria. That due to stress they have urticaria. So does stress urticaria looks any different from the urticaria?
See, it is a very debatable form, but stress urticaria do happen because sometimes people who are we always get a history that there is a lot of stress a person is going through, and then they develop hives. Then we have to treat them, treat their psychological condition as well along with the urticaria.
Okay, doctor. So, doctor, we also have a live viewers question who are watching this live. So, Sonam Sarate is here, and she's asking, Doctor, what are the common triggers for urticaria?
Thank you, Sonam, for asking. See, triggers for urticaria vary from person to person. You may develop urticaria after eating prawn, but I don't. So, prawn may be a trigger for you, but for not for me. So, likewise, because you are allergic to prawn, so certain food items, like as I just said, prawn, shellfish, um, brinjal, sometimes egg, sometimes color, alcohol. Those are the common tomatoes. Those are the common food items. Some medications like aspirin and NSAID means painkiller, certain antibiotics like penicillin, and all other antibiotics can give you arterial rashes only if you are allergic to it. Nobody we can't actually avoid urticaria. Sorry, what should I say? That we can't. We are some. Maybe I am allergic to something. I may develop urticaria with so and so things, but you will not be allergic to that thing only. Likewise, pressure is an urticaria. Pressure is a trigger. Some people develop urticaria when hugged tightly. That is called pressure urticaria. There is a variant of urticaria called cholinergic urticaria. After taking hot bath, or when the people is sweaty, or when they exercise, they get urticaria. That is cholinergic urticaria. Some people develop solar urticaria. Some people may develop urticaria while touching a piece of ice. So these are all physical urticaria. These are all triggers of urticaria, but that doesn't mean this trigger will trigger your urticaria case.
Okay, so as doctor said, there are different triggers for different persons, right, doctor? If you
Yes,
are
yes,
allergic
yes.
to something, that can be a trigger for you, and if you have like going to sunlight triggers your urticaria, that is your trigger. So there are different triggers for your urticaria, and you have to take care of yourself. Doctor, we have another question from our live here, A Raju, asking, is there any specific diet or lifestyle modification that can help manage urticaria?
Um, diet and lifestyle modification. First thing is, if you are an person suffering from urticaria, you must visit your dermatologist first, because or he or she will find out what kind of urticaria you are suffering from. So if you are suffering from chronic urticaria, no amount of lifestyle change will help you. And because chronic urticaria usually doesn't have trigger, very rarely we can identify a trigger for you. But if you have a like just previously I answered this question actually. So if you are allergic to prawn or shellfish, then you should avoid shellfish. If you are allergic to alcohol, then you should avoid alcohol. If you are allergic to certain medications, you should avoid those medications. But only you please take your guidance from your dermatologist. Why? Because if you are having urticaria, and if you can recall that these are the things you are allergic to, you develop or you did before you getting those rashes, then we will be asking you to avoid those things. Sometimes there are certain tests so we do, but the tests are not foolproof. Your dermatologist may sometimes ask you to go for an allergy test, but the tests sometimes are not foolproof. So your participation is important. You will be able to tell us what kind of trigger you face, and what makes you get those rashes. Then only we will be able to guide you properly.
Right. So it is your concern that you should identify your trigger. That if I've eaten something, if I've eaten prawn or a sea fish or anything like that, that is causing the trigger to my hives. Right, doctor?
Yes.
So, as doctor said, that taking a proper diet, avoiding things that can trigger your hives or urticaria, you should take care of that. Doctor, we have seen that after COVID, so many people complained about hives. So, can COVID treatment or the COVID itself can cause hives on the face or neck or hands?
Yeah, very rightly so. The question is very prompt and very. So we have seen a lot of post-COVID urticaria cases, various kinds of urticaria, and very severe articarial vasculitis rashes. So we have seen those cases during post-COVID patients, and also in COVID patients who were admitted in the hospital. So, see, as I said, that infection can be a trigger. Like streptococcal infection, we know, but we came to know last year only that COVID virus infection is also a trigger. And nowadays we don't find those cases, but there was a rise in urticaria cases last year and in 2022 and 21 also.
Right. So due to COVID virus,
Induced urticaria.
it was there, and you can develop hives due to COVID urticaria also. And as doctor already discussed, that it can be the trigger can be anything which is like your body is irresistible of. Doctor, we have a live viewer at Vik Singh and asking, can urticaria be a symptom of an underlying medical condition?
Yeah, there are various medical conditions like autoimmune conditions like SLE, rheumatoid arthritis, certain vitamin deficiency, thyroid disorder, diabetes can lead to urticaria. So whenever a patient with chronic urticaria comes to us, we always check certain parameters to find out whether you are having any underlying diseases or not.
Okay, and you have to go and refer to a dermatologist if you are having any kind of urticaria. Doctor, we have discussed, about the types of urticaria, the triggers of urticaria, and now we would love to know what are the treatments which are available for acute and chronic both type of urticarias, how it can be treated.
See, the first thing, you have to identify the trigger and avoid that trigger. But that will be late. First thing, we have to make the patient comfortable. For that, we will need antihistaminic. There are various types of antihistaminics available: sedative, non-sedative, H1 blocker, H2 blocker, so many. So your dermatologist will decide which antihistaminic to give and when to give and how much and what is the dose. That is only your doctor will tell you. But first line of treatment is antihistaminics. Along with it, sometimes we need to give high dose of steroid for a short period of time in case of severe acute urticaria. So maybe for 4-5 days or so. So we treat them but chronic urticaria patients, more often than not, along with antihistaminics, they need certain immunomodulator medicines like cyclosporin, corticosteroids, and so many things, and certain lifestyle changes. And also, we try and find out whether other. I forgot to mention that. Some certain stomach infections, certain urinary tract infection also can give rise to urticaria. Sometimes we find those things out and treat those things as well. So these are the line of treatment. First line is antihistaminic. Second, immunomodulator, steroids, etc., and other supportive medicines. If you are vitamin D deficient, we have to treat you for that. If you are having thyroid disorder, so we have to. I'll refer you to somebody who will treat you for your thyroid illness. So likewise, and also certain topical agents we also give, so that you feel better when you are having the rash. And we ask you to avoid the trigger. Means if you are getting urticaria from hot water bath, I'll ask you not to have a bath in hot water. Likewise, and food items to avoid. This is it. And sometimes in case of urticaria with medication, we will always have to avoid those medication and remember which medicine give you urticaria. So you will have to always remind your doctor not to prescribe those medicines. That is very, very important.
Right, doctor. And as you said that, a patient can be treated according to his or her medical conditions, like if already some medicines are going on, so can be treated likewise. Doctor, really would like to know that acute treatment will be of, how many days or how many weeks, and chronic of how many weeks or days, and can it reoccur again if the person is not taking the full dose or the full medicine? Because people usually do that they see that, the itchiness is gone, the redness is gone, they left the medicine halfway only, they don't take the full dose.
Acute is usually a very short period of time. Always treatment duration is less than 6 weeks. Always less than that. It usually goes, and we don't also pester that you have to take medicine. If you feel that you are getting those hives, then only you take medicine. But for chronic, we always ask the patient, please complete the dosage, please complete the medication schedule, complete the course. Because what happens is chronic urticaria, there are known patients who has been suffering from chronic urticaria for a long period of time, maybe years, maybe 12 years, 15 years, maybe so many times they have to continue medicine. Chronic urticaria is like that. So if you fail to stick to your medication, you will definitely see relapse in case of chronic urticaria.
Right, doctor. So we have discussed about urticaria, its symptoms, its treatment. Doctor, any take away message for all the viewers who are watching this live before we end this live session?
See, urticaria is a very common, and I think everybody have experienced urticaria in their lifetime, almost everybody. So one thing always I ask my patients to uh, this thing, that urticaria sometimes can be life threatening. So if you feel any choking sensation to happen, or if you're feeling that you are getting rashes around the eyes, take an anti-allergic first. And if you feel that you are having breathlessness along with itching, rush to a medical facility, rush to a hospital which has emergency care facility. Because EpiPen or epinephrine may not be available in a doctor's clinic or in a pharmacy. So because our infrastructure is not like that, somebody who knows that they are prone to great urticaria, they may carry EpiPen, but it is not always available in everyone's clinic. So don't waste time, rush to the nearby hospital, and always avoid the known allergens which you know that give you rashes. So with that, you should always take care and stay healthy, and always keep antihistaminics with you for emergency purpose.
Thank you so much, doctor. And as you said that please go to a dermatologist if you are having any kind of urticaria or problem. Thank you so much, Dr. Sarmistha Basak, for your valuable time.
Thank you. My pleasure.
Thank you so much, doctor. It has been a very informative session for our viewers, and I am sure that they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, now they know that instead of self-medication, it's better to approach a nearby dermatologist. It's great to hear you, and we really look forward for many more such sessions in the coming time for all your viewers. And thank you, viewers.